My name is Olaiton, and I'm here to share my fibroid surgery experience. Now, I'm going to start from how I found out and where I think my problem came from. I might be wrong, I'm no doctor, but that is what I feel. I feel like family planning, caused mine, but I'm not very sure, but that is what I feel. Now, I'll tell you why I said so. I had my last baby in 2014. Of course, it's the normal thing. You don't want more children, especially we married women. We're always very scared of more babies. So I was just so scared. So I needed something to not get pregnant. So I started with the injection, with every 3 months injection, and I think I took it for like it took like 2 times. I think I went 2 times, but I opted for implano, the implant, the one they put on your underarm here. I opted for that because I discovered that I was adding weight for that injection type, and I would also forget. I always forget to go on the dates that they give me. So I went for that one, and I did 5 years, and for 5 years I was fine. I was having my flow, even though mine was different. It wasn't like people around me. Some would say they did not see it, they stopped seeing it. I even wish I stopped seeing mine. Some would say they stopped seeing their flow. Some would say it was irregular, but mine was normal. I was seeing my flow. So after 5 years, in fact, in those 5 years, I think I left Lagos. So I think going to Lagos and leaving Lagos, no, I left Lagos. In those 5 years I was fine. I didn't have any reason, because I came back to Lagos even before it was 5 years. So, but I came back to Lagos in 2019, and then in 2020 it expired. Okay, that means I did it in 2015. Yes, I did the family planning stuff, the 5 years old. I think I did it in 2015. Yes, I did it I had my baby March 2014. So I was taking injection, and then the following year I did. And the reason why I said so is because it was now 5 years in 20 what's it called in 2020. So 2020 I went to the hospital. 2020, like January, February, kind of. I went to the hospital, to renew it, and they didn't have the 5 years on. Now, for fear of going home, and at the end of the day, excuse me, for fear of going home, and at the end of the day, I forget, and so I took the 3 years, because I really wanted the 5 years, so I had longer period before I would go back again. So I took the 3 years. Now, after taking the 3 years, on my next flow, I noticed that it was crazy, but I was enduring. I didn't know it was changing something in me. I was enduring. The flow was heavy. I went to the hospital to complain. They said I should go and buy combination, the one you take every day. Maybe to just kind of subside, like regulate it or something. I bought it. It wasn't still working. Like I would flow for like 2 weeks non-stop, instead of normal 4 days, maximum 5 days. 5 days, I would flow for like 2 weeks non-stop. So it was going on like that, and they just kept telling me I should be watching it. It will still normalize. It will still normalize. And then throughout the year 2020, this thing did not normalize. I was losing blood. I became anemic. Like I was short of blood, but not as bad. And then something significant now happened. So on one of my flows, in fact the last flow before I had to go to the hospital and found out about this fibroid thing. So I went to pee. I was on my flow, and then I went to pee. And then I'll probably share the video. I'll probably share the picture at the end of this video. I'm sorry, I don't know how to edit, and I don't even have time. So I went to pee, and then I saw this huge blood clot drop, as if how it was huge. it was a lot. I've never, of course it's normal, you see small blood clots, but this one was huge, as if I had some kind of miscarriage. So I went to the hospital that very day to complain, showed the doctor. The doctor was even like, it's normal for some women, it's normal. I'm like, this is not normal to me. I've never seen it before. It was like, I think he even prescribed something, tranexamic acid. I think he prescribed that to me. Yes, in fact, severally that was prescribed, tranexamic acid, to like reduce the flow, but it wasn't working. So I now told the doctor I would like to do scan. Let me just check that everything is going fine down there, and then only for the scan to reveal that there's something small growing in my uterus, and that was the beginning of a fibroid. Of course, the man there that attended to me was like, I should just go and have surgery and remove it. But me, I'm like, me, never. Because I was always scared of surgery, because that's what they make us believe, So I said, never, me, surgery. So that was how I went on with my life. And then I removed the family planning. You understand? I removed the family planning thing, and then I went on with my life. So that is how 2021, I found out that I'm always feeling tired. I'm always feeling tired. And this thing started growing 2021, so since then I started doing scan from time to time. So, but I was also using tranexamic acid, because my flow later on started becoming really heavy. My flow wasn't even so bad after I removed the family planning. But subsequently, I think as the fibroid grew, my flow was now getting so heavy. I was also always weak, losing blood. And then in 2023, I was so weak because my blood level, my blood count had gone down to 19. Can you imagine? 19%. My blood count had gone down to 19%. So I had to go to the hospital. Thank God, they didn't force me to take a blood transfusion, because I told them I don't want blood transfusion. So they gave me this, I even have it in the room now, this kind of injection like Totema, like a blood tonic, but I think it's more powerful, Totema, or other Totema, I don't know how they pronounce it. So I was given that one, so that really boosted my blood to like 24%. So they said, okay, I should just keep going to, so they allowed me to just keep eating it, and they didn't give me blood. And so, but at that point, I knew I couldn't go on with life like that, because it was affecting everything I do. I was always weak. I was always tired, short of blood, always looking white. I was always looking pale. So I even tried all this herbal stuff, herbal tea, DDD. It did not work. Nothing shrunk. I would take the tea, even one Chinese tea I took, it wasn't shrinking, because from almost every 4 months at least, I would always go for scan, and I noticed that after a while it was now 2. It was no longer one small one, it was now 2. In fact, after a while they saw 3. But apologies, my phone went off. It was very hot. iPhone, I don't know. So, and I didn't put on much because of noise. So eventually I think, because if you notice, it was just one big one and a very small one. So I think eventually joined together the 3, because at the point they were seeing 3. So, but let me go to when I now decided to do the surgery. 2024, a friend of mine, she started encouraging me. She said she did that. She told me how she did that. She told me the hospital. She used one hospital, So I should even go and use our hospital. So I went. I even paid for the card. Started going there, and eventually, I now found out that the hospital that I had my children, which is a very good maternity hospital, and I didn't know they were also now they do this fibroid surgery thing. They are now a general hospital. So I found out that they are also doing, and they are not far from me compared to the one where my friend did her own. So I now went to, enroll. I went to register in the hospital where I had my children, and I was booked. So I was booked for April. I was told the things to get. I already told them everything. They said I will need blood, that somebody will need to donate 2 pints of blood. Of course, I told them I don't want blood. The doctor said, but I must to donate blood. They said I should not worry, if I don't lose too much blood, they will know. I said I don't want blood. I don't want blood, not for any reason, but because I just don't want somebody's blood in me. I just don't want it. So I said I don't want blood transfusion. So my doctor said they would try. So I was booked for April 17, but something happened. I had already packed my bag, said my goodbyes to my children, crying. And then, only for me to get to the hospital, and they told me that, of course, my brother was supposed to come and stay with me, but I told him to just come. It was on a Thursday, so I just told him to come sorry, I was going on a Wednesday, so the surgery was on a Thursday. So I just told him to come and, meet me at the hospital in the morning. So, but on getting to the hospital, my doctor said, I'm sorry that that's the problem with government hospital. They don't have so much capacity. So that's why I will not really be mentioning my hospital in these videos, except for those that probably would now reach out. I can tell them individually, so that, because they don't have capacity. They don't have capacity. I don't know if I should mention the name of the hospital, but trust me, if you have the money, there are a lot of private hospitals that are very good, if you have the money. But if you don't have the money, maybe you can reach out to me, and then I can tell you the hospital, especially if you are close. But at the same time, you don't have to even use the hospital I use. You can always, just make sure you research about the hospital. Make sure that, but you will find out the questions that you can ask your doctor from this video if you stay with me and watch this video to the end. So when I got to the hospital, my doctor said that she's sorry, she will not be able to perform the surgery again, that they had an emergency, and that there is no space. That is why I said there's capacity, there is no space. They have too much work, and they don't even have many doctors, no bed space. So she said that there's no space, that she will not even be able to do my surgery, because they had one surgery done the previous day, I think that same day, Wednesday, but the woman is having some complications, so they will need to open her up again, the next day that they booked me for. And it's still my doctor that is doing it. The other doctor had already gone on leave. So, so she said I should go home. So I felt bad, because I had already I already zeroed my mind that, okay, at least I will do this thing by Thursday evening, I'll be out. And then they now made me go back home. And then I was now thinking, maybe I should not do it again. Maybe this is a sign. Maybe I should not do it again. Maybe this is a sign that I should not do it. My friend, the year when my friends and acquaintances, the year when, because I would call them to complain. I would call them to tell them my fears. But I'm so grateful to them, because they were all ready to listen to me. They were all so helpful, especially those ones that have done the surgery. They were so helpful. I'm so grateful. So I would call. So they would tell me, don't worry, it's not difficult, it's not that bad, don't worry, just do it. Because I now said, maybe I should not do it again. Maybe I should just keep living. But I couldn't live on like that, because I was always losing blood. In fact, let me mention why I now made up my mind to do it. Now, I'm currently going through my divorce, and I went to see my lawyer. In fact, this was what made me make up my mind to do this thing. My lawyer lives a few buildings away from mine. And then I was on my period. I had padded very well. I had padded very well. Trust me, very, very well. Sometimes I would double. I was even using diaper. Is that bad? Double. Although I didn't have diaper that time, because I had already exhausted all the diapers that I have in April, because I was waiting for the surgery now. So I just thought this is the end of diaper. So I used pad, double the pad, and then even put it But guess what? And I already planned that I will not stay long at my lawyer's place. I just went to brief him and and then by the time I got up, I just saw something drip, around my leg. Hey, thankfully my lawyer, that is a male, he had already stepped out. It was just me and his wife. So I now quickly told the wife she should get me tissue. She should please get me tissue. And then I wiped the one that was dripping down my thigh. And then just thank God I was wearing I was even putting on a dress. Maybe if I was wearing a trouser, it wouldn't be obvious. So I now quickly rushed to my house. So I just said, hey, is this how I'll keep, living with this thing? So that was what made me just say, I'm going to remove it. So that was how I made up my mind to do the surgery. So I went to the hospital again. They checked me. The tests that I had done before, I had to repeat some again, So, different tests for different ages. Do you understand? When you've gotten to a certain age, you probably have to do more tests. So, but I did some tests, to check that everything is fine. Did the test. So, eventually, I was booked again for 2nd of June. So, I asked my doctor. So there was not the doctor that operated on me, not the surgeon now, the doctor that attended to me. They will be seeing you from time to time before your surgery date. So I asked the doctor. I said, "Is it possible that I lose my life? Is it possible that I die?" And guess what? He said yes. I said, "Yeah, I'm not doing it again because I'm not ready to leave my children. He will take care of them." So I guess he answered me like that, That answer first scared me, and then he answered that I should calm down. He said, it is possible, but that is why they are there as doctors, that they are going to make sure that nothing happens to me. That is why they have this. I said, okay, is it possible that I bleed, that I have bleeding issues? He said, yes, but he now gave me an example with his system on his table. He said, this system now, is it possible that it can fall down? I said, yes. He said, but maybe it's here now. Before it could fall, he will quickly hold on to it. He said, and at the same time, they already put some stand around it to make sure it doesn't fall. I said, he said, so that is that. It is possible. But they are there. That is why they will put things in place to make sure that doesn't happen. And then the doctor now said something that actually really put my mind at rest. He said that was his 8th year, 8 years in that hospital, and in the 8 years that he's been in that hospital, that he's not had any case of death from myomectomy. So when he said that, I was calm. So, but then I still went home asking my friends question, how did it go? Especially those that have done CS. How was the hall? How was the this? Different questions that they had to like, calm down, madam, calm down. How does the anesthesia work? I was asking different questions. And thankfully my friends, they were there for me, answering all my questions. And then Google too was there for me. I was Googling everything. In fact, I Googled as much as how the theater room would look like, so that I know the things I'll be facing, because I was so scared of those their objects, those their different equipment. I was scared. The only experience I have, the experience I have delivery, natural delivery, or I don't know if it's natural that I'm supposed to say. All deliveries are normal. Okay, like vaginal. Yes, vaginal delivery is the experience I have. And the setting of that one is different from where they are actually like doing surgery, where they are opening someone. So that one is the only one I have. Even that one today, I think they have all those small scissors. I don't know, but this theater for surgery, they have all those things that will just scare you, all those lights. So I just was Googling everything to like have an idea of what I'm going to face. So they told me the things to get, different things, I can't remember some of them now, but don't worry, when you get to the hospital, they'll tell you what to get. But some of them too, I didn't get all of them, so later on they won't even tell you everything. You won't get, some of them you will buy at the hospital, some my aunt, went and got them for me, So when I got to the hospital, so I went to the hospital on Sunday. My surgery was supposed to be on Monday. It was on Monday actually. The other one was supposed to be on Thursday. But my doctor they said they do this kind of surgery on Thursdays, but my doctor was kind enough because they wanted to give me a longer date again. I said, please, you will make me change my mind about this thing. So she now said, no problem, don't worry. And she was also going on leave. She said, no problem, I should come. She will do it on Monday. So she now said I should come on Friday. I said, I now beg that. I cannot. She said, so that I'll be there. They can be checking me and all. I said, please, there is nobody to stay with my children. But I cannot come. That please let me come on Sunday since they are doing the surgery on Monday. So I begged her. She said, okay, no problem. But I should come early on Sunday. So I went Sunday morning. So they said I shouldn't eat some hours before the surgery. But me, I told myself, I said I won't even eat at all. So I just bought only apples when I was going to the hospital. But guess what? Hunger started doing me shaggy. The apple, I ate one. It wasn't working. Two, it wasn't working. And then the nurse, I saw the nurse eating fried rice and chicken. Ha. Now the nurse that, can I eat? She said, yes, now that it's just few hours to the surgery that I shouldn't eat that. But for now, I can eat. Well, it was still noon. I think it's maybe around 11, 12 or so. So she said I should eat. So she was even kind enough. She helped me to order food, the same one she was eating. So I ate that one. And then the hospital also, I may just share all these things at the end of this video. So the hospital also gave me amala. And I also ate the amala. I mean, I didn't want to eat too. And a friend of mine was telling me, eat now. Maybe it's in the night that you will not eat. I said, no, I can manage. So even the amala they shared in the evening around 5, 6, I collected and ate. And then drank water. And then I think from like 10 o'clock, the nurses now said I shouldn't take anything again. So, but before then, the doctors came, checked me, checked everything to be sure that BP, everything was okay. And then the anesthesia doctor too came. It was like, I should not worry. I love everything. They were so nice. I love the experience. Well, am I supposed to love the experience? Well, maybe because I was expecting something worse and it wasn't bad. So I guess maybe that's why I said I love the experience. But I'm always very grateful for little things, of course. So I loved how the doctors were so calm to explain. Of course, some nurses are always so cool. Some nurses in Nigerian government hospitals, they are not always so nice. But a few of them were nice, but some were not really. But doctors, the anesthesia doctor told me that it is possible that when they administer the what's it called in me, that I may shiver and may start shivering, like it's normal, I should not worry. So he told me the things to expect. And then, they said I should go and, the morning came, they said we should go and shower. Morning of the surgery, we should go and shower. And that's how I showered very early. In government hospital, you have to, because plenty of people will take their bath and you have to take a bath before the next shift person comes in, so that, So meanwhile, I forgot to mention, there were people that I met, at the what do they call that place? The hall where they keep, in Nigeria here we don't have private rooms. Of course, they said they had private rooms, which is what my friend said I should request for, that he was going to pay, but they said they stopped in this particular hospital. They stopped because they don't have space. They said they have private place, you just pay a particular amount. So I was going to go for that, but they said they've already stopped. So we were all in the hall, plenty people that just gave birth, people that did this surgery too. So there was a particular woman that did this surgery, which is why I would advise anyone to please stop living with it. Just do something about it. Do something about it. Go remove it. Trust me. Just make sure you choose a good hospital. Make your research about the hospital before you go there. Trust me, you'll be fine. I know it can be risky because my mom's friend rather, she traveled 2 months ago. She passed 2 months ago. She traveled to Ekiti State to have the surgery done, but she didn't make it back alive because she didn't choose good hospital. That's what I think. That's what I think. I know, we also need to put God in all of this, but trust me, she was a believer in God. She was a worshiper of God. So I feel like she chose the wrong hospital, because there are several hospitals here in Lagos that she would have chosen. But also, God knows, I really don't even know what to say at this point. So the woman lost her life, and a lot of other people like that. In fact, some people also lose, because if you say you should also leave it, you can also end up losing your life. In my own case, I was losing blood, but mine was not so big. But for those that are very big, at the end of the day, the thing will rest on your organ. So I know of someone that also died, because of this thing. They said they were telling her to go get it out, she doesn't want to do surgery. And then, it affected her kidney, I think, and whether liver or kidney, I don't know. But she affected her organ, and she passed. So trust me, everything has its own risk. You just need to risk it. And then choose good hospital. Because if you say you should leave it, trust me, those herbal stuff, they don't work. So let me continue. I don't even know where I stopped at this point. Okay, so we took our bath. You have to bathe early in government hospital so that the next person that's taking over the shift, you must have bathed before they hand over to the person. So we bathed quite early. Bathed quite early. Those of us that will be going for the surgery. I think I was the only one going for fibroid surgery that morning, while some other women were going to have their babies. While fortunately another person came in too, but she was going to have her surgery the next day. So it was time. They didn't start my surgery until I passed 4. People were going, they were taking people in for their childbirth. I think surgery too. I don't fibroid surgery, so I'm not sure, but CS for babies, CS, so they were going and coming back. So at past 11 a.m., it was now my turn. So I went in, and they went to bring the blood that I donated. I already begged the nurse and the doctor that I don't want to take blood, but of course they brought everything in. I begged them. They said everybody must keep it closed out, but they are not going to give me if I don't need it. I said I don't want. They should please not give me. So it was time. Don't mind me. I hope you are still with me in this my talk. So it was time for the surgery. So I went in. I was wheeled in. They said my brother should get a bucket where they will put the. I'm still going to talk about. I hope I remember. Let me see if I can write it down. I'm still going to talk about what you should do. Well, if you have the money, the test they did on the fibroid thing. My brother paid because I dropped my card with my brother. Just in case anything emergency. So I dropped my card with him so that anything they need to buy, he will buy. My brother, they gave him the fibroid. My brother went to go and do test. 30,000 naira to do test on the fibroid. Say, waiting now, what am I testing on the fibroid? A lot of people that did the surgery after mine, they didn't bother to do the test because, okay, so what did I do with the test? My 30,000 just went like that. So, but I've jumped. Let me go back. I hope you are still watching me at this point. My talk is too much. I enjoy talking actually. So it was time. They administered the anesthesia drug. I don't know what they call it in me, and I started shivering like the doctor said. Even though it wasn't in all cases that people shiver like that, but I started shivering. As if I was cold. They asked me, "Am I cold?" I wasn't cold actually, but I just couldn't control it. My teeth were just shaking, like shivering. That feeling of when you are cold, but I wasn't cold. So they now started like testing if the stuff was already working. Am I feeling this? I said yes. Are you feeling that? So they tilted my head to the back, and they still said I was still shivering. And then later on, they told me as well that I would not feel pain, but I will feel pull, like they're pulling something. I was even like, I don't want to feel that pull safe. So I really wanted to just sleep off. My friends already told me about sleeping. My friends already told me that they slept off. They didn't feel anything. So I just really wanted to sleep. I really just wanted to sleep. I prefer that one. I didn't want to be awake, but my doctor said they will keep me awake because that's the best. That's what they do now for safety reasons. But my friends had their own. They slept maybe because their fibers were bigger than mine. I think depending on how the size of the fiber, because the incision may be like this, or at your lower belly, at your lower abdomen. It's possible that's where, just like my own, that's where my incision is, but for some it will be straight. So that was the last thing I remembered, but I noticed that they cut something. I felt that pull. So that's the point I knew that they had already opened me. So I felt the pull, which is what I don't want to remember. Thank God I did not remember more than this, because I just wanted to sleep. So, but I know that I know when, I remember that I know when they caught me. And I also know that I noticed that they were trying to like, I don't know, struggling to widen my tummy or something like, well, not struggling, they already used to it, but you know, like trying to, I know that time because I was feeling the pain. But that was the only thing I remember until around maybe to 1, because by the time I opened my eye in the hall, like, what do they call that place that everybody will be now? I've forgotten. Where all of us will be after the surgery. So I don't know, I can't remember. So they were already done and they were wheeling me out and they were saying, I was hearing the doctor say, Olaiton's family. So I was hearing that. So I think that was when I started coming back to life. I mean consciousness, of course. So I was conscious, even though I couldn't open my eyes yet, but I was now hearing that, I enjoyed that anesthesia, something, or the sleeping one. I love that I slept. I love that I wasn't awake. Because that feeling, I cannot describe it. I love it. I think that this is the interesting part of my surgery because I love the fact that I was not awake. I didn't want to be awake, so now be worried about what they are doing, and you know, the surgery took like almost 2 hours because I entered around after 11 or so, or was it 11? After 11, I think, and I was out around 1 o'clock, or is it past 1? I can't even remember because I didn't open my eye immediately. They were done until I got to the hall, you know, to my room. Let me just say room, you know. I've forgotten what they call that place. So I didn't open my eye till then because I noticed I know I could hear my brother say, she's my sister, and then, you know, they started pushing. So at that point where at a point, I think maybe I was still inside, they gave my brother that stuff to go and send somewhere for them to test. That's where he went to pay that 30,000 that I said. I did not like that 30,000. But my card was with my brother. He was buying everything, medication. My brother tried to do that nonsense, naughty boy. He really tried for me, and I really love him. I care about him. He really tried for me, even though we fight sometimes, misunderstanding. He was really there for me. My last baby, I think when he was like 8 years plus. So me too. I've trained him. So it was like a payback because he took care of me as well. He was one going up and down to buy, and my aunt too. My aunt works in that hospital, so she really helped as well. She washed some of my clothing and all of that. So I was really back to the hall, and before you knew it, you know, in fact, that one terrible thing, they didn't put me well at all. I can still remember that one. You know, because you cannot move and everything. It's just like they're carrying they're carrying a dead body. You know, that feeling was sweet. In fact, it was peaceful. That's why I feel like the dead people, they are at peace. It's we that we are on earth that we are still struggling. They are at peace because, trust me, that feeling of not being awake was really peaceful for me. So as I was saying, it was a peaceful sleep. At least I didn't get to remember. Because see now, I still remember how they were pulling. And of course, it was a government hospital. You know, if it was a private hospital now, they'll probably allow somebody to be there by your side, just the way I see in pictures or videos of childbirth, you know, delivery, CS. I don't know if it's the same with this surgery. But you know, if you would be able to have someone beside you for those long 2 hours, it would be cool. But just me. Of course, they said the anesthesia doctor will be there to this to channel that. I don't know, but I just wanted to sleep off. I don't want to remember anything. So, and I thank God it went like that. So the way they just dropped me on the bed, you know, because I couldn't move yet, so I was just not comfortable. Don't worry, just tell them everything you want. You know, this one public hospital, I really don't have a choice. So they just dropped me. You know, they just carried me, dropped me, so I couldn't move well. You know, so I started feeling, you know, some part of my body, but I couldn't move yet. You know, it took hours before the what's it called, wear off. And when it wear off, you know, decided, you know, even me myself, they said I should not move. Hey, one thing they warned me not to do, that the anesthesia doctor even told me before I went for that I should not raise up my head at no point. That is very dangerous. It causes a particular headache. So I listen to all their instructions, and that's what I would advise. Whatever doctor tells you is what you should do, and then don't hide your history from them. If you had abortion, those are the questions they will ask. If you had abortion, your health complication, family history, don't hide anything from them. Make sure you are open, tell them everything, because that's how they will know what and what to use on you. If you have ulcer, all those things. So please just be, because these are things that actually lead to death sometimes, not the process, not being truthful, not telling them so that they know what and what to do. They know alternative medication to use. For instance, if you have ulcer, you tell them so that a particular antibiotic that may not be good for you. So what was I saying? Talk too much talk. So I wasn't. So but later on, after some hours, I started feeling my body. So they said I shouldn't raise my head yet. So I also did not raise my head, but I was trying to adjust because I wasn't comfortable at all. And then after a while, I started feeling pain. So they now administer some injection. I think for that day, for some days, and then I was not able to eat yet. I was not allowed to eat yet. Even water, I couldn't drink. I think it was after like 24 hours that I could drink water, and not the water was just like, just one cup of one this thing like this. That's why they were feeding me 24 hours. I think it wasn't up to 24 hours. Then I must fast first. You have to fast first. So I had fasted. I think I fasted early enough. So we started with, I was so thirsty. You have to fast first before they give you some things. So I started with water, like this. So they would say just take two, that's why I was taking water. And then I think after 24 hours, and since I fasted already, I was allowed to take pap. And then after I started taking swallow amala. I took amala, started eating small. And then, the medication, the drip, everything, different drugs. And of course, if you notice in my video, I'm going to drop it at the end of this video. I don't know if I should drop these things before the video and at the end. So, but for people from Instagram, if you notice, there was this kind of holes, in my tummy. So they said, because someone else that did surgery didn't have it, but the woman I met had it, and then the lady that came after me didn't have it. They didn't put it. So, but they said it was to bring out the, the waste that's probably still stuck in my body. I woke up to see the. It is well. Being a woman is not easy. It's not easy at all. So I woke up to see that. I don't have pipe. I'll be host. So they said it's because of. So the woman that I mentioned that I met at the hospital that had complications from, the fibroid was already, her womb was big, so it was already getting that she had to buy plenty antibiotics. I don't know if I said that already. So the woman, when they wanted to discharge her, so that's why, don't judge your case. That's why I'm very happy about this massage, because I feel it was interesting, because I had already when you sentence yourself to something serious and it wasn't even so. The woman, before they discharge her, she also had that pipe, and then before they discharge her, so I feel like it's because she had complications, organ, whatever, because when they discharge you, I think they will do something, massage, remove some things, because they will also pass. Okay, so the morning of the surgery, so they passed. There was a medication they put, in my vein, and also passed a particular catheter. What do you call that thing? For pee, for your urine. So that was the one they passed when I was awake. It was when I woke up after surgery that I saw this other one. I hope you are still watching this video, because I know my talk self is too much. I hope you are still with me. I will not start judging by the views. But it's all good. It's all love. So the woman was just kind of screaming, when they wanted to discharge her. She was screaming, like the thing was painful. I said, this is my own will be. Guess what? I now thought maybe it's when I thought it was the pipe that they were removing that is making her cry. So I was already thinking, this is a pipe. Oh, that's not that thing. I said, hey, so when you want to, I don't know what they call it so please manage it. But I thought that my own too would be like that. I was already so scared. Hey, so when they wanted to discharge me, of course, I took some medication. I know I've jumped medication and all of that. I'm still going to talk about the expenses. So I took some medication. They gave me medication, drip, and all of that. I made friends. And now, why I said government hospital, because they were just moving me from bed to bed. The longer I stayed, I did the surgery on Monday. I was discharged on Thursday. But trust me, the first day, they allowed me to stay in one place. Next day like this, they said I should start moving around. Before I got back, they already moved my bed to another space because they get more people. And then they want people that they just did their surgery to be closer to me. So, they moved me down. Before you know, they moved me to another room. Trust me, it was from that room that they discharged me because they don't have space. That is why I said I will not mention this hospital, the name. But if you know you desperately need to do it, just reach out to me. I'll tell you. But I don't want to leave it open to everybody because you that you are not in Lagos, you can stay in your state to do it. Just find out about the hospital very well. Fine if you want to come, but trust me, that place is already crowded because when you go like this, when you go, before you go home, it's always because they don't have plenty doctors and we are always so much because the government hospital now, what do you expect? So I'm going to still mention the hospital is on the mainland, Lagos mainland, you understand? But there is one that I was supposed to first use. That one is very good. In fact, there's a particular doctor that was already attending to me. So sweet doctor, she's on Instagram. I reached out to her in Nigerian. My friend told me about her, of course. So I already reached out to her. She was so nice to me. I met her. She listened to all my talk. Me, I can talk and complain and lament and ask questions. So she listened to everything. The doctor was so sweet. I would have mentioned that too, but maybe later if she permits her. So she was so sweet too, and she told me the day I should come so that I register under her and all of that. So what was I saying? So they had to move me to another room, that's why I said, in fact, there was a baby that was rushed in for emergency and I could hear the director or something, I don't know, someone in charge so saying they shouldn't have, they would have referred them to another place, but there was no bed to put that baby, trust me, because the children ward is what I've been trying to remember. The children ward was already filled up. Can you imagine? And they had to bring that baby to adult place because there was no space. So the woman was like, they should have just referred the baby to another hospital to this and so that's why I said I won't mention the name, but for those that are on the mainland and really, I know the hospital is on the mainland, so if you like, you can on your own research. But for those on the mainland that would probably need to know, you can reach out to me and I'll tell you. You can call my number from my Instagram page. Call me and I'll tell you the hospital. But I just don't want to leave it to the public. Even people that are not in Nigeria and all of that, mentioning the hospital name, I really don't know. Their capacity is very, 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 very small. So, of course, even the other first one that my friend used is even bigger than this particular one. So, they moved me from one room to another. Eventually, I was discharged, and I forgot to mention, they didn't use the blood. Fortunately, I didn't go. Of course, I think my blood was on like maybe 24 after the surgery. My blood was like on 24 after the surgery or so, 24%. But right there, they were giving me stuff to eat, and then medication, this Totema too. And then, after care, I'll be going to the hospital, for checkup and all of that, for cleaning and checkup. So, I was discharged, gave me medications, and then listed some that I needed to buy. So now, going home was another thing, because, moving, moving, hey, the pain. And then, even in the hospital, because they said I should walk around so that the blood clots, blah, blah, blah. Moving around was cool, but getting up and lying down is the pain. But trust me, I feel like once you put your mind to bigger pain, by the time you see the pain, that's why I'm excited to talk about it, because it was just a walk, a full man. So what's that? This thing, walk in the park for me. It wasn't as as painful as I thought it would be. So I was discharged. I made sure that I was begging my driver not to enter potholes, so that big. And then when I got home, I'm still going to make another video to talk about my flow, my flow. I think I'll make another video to talk about my flow after, because this phone now can still go off, is very low now. I'll talk about my flow, after the surgery, and then, I can also post some videos. But I hope this, in a little way, has encouraged you to know that fibroid surgery is not a death sentence. Now, this fibroid hospital that I said that I liked, that I would have used, Falade Hospital. Yeah, I think they charge in millions. So, but they were doing discounts, promotion, something like that. He said he did 40 women, something, free surgery. But of course, the free surgery, but you have to also budget at least 600,000, 800,000 for their test, for admission, admission, registration, I do that one. You have to budget. So me, I didn't have that much, and already this my hospital. I paid 250,000 naira for the surgery and admission, and then you now do drugs. So trust me, depending on the size of your, you can take someone to donate blood for you, or you just, they can help you get someone, you just pay. So it's possible that way, but you have people that are willing to donate for you. They may not even use the blood. In my own case, I didn't use the blood for me because I didn't want it. I begged my doctor, my surgeon, that I didn't want it. So now I'm saying you can just budget, because now I'm sure it would have increased. But it was 250,000 naira that I did the surgery and admission, and then I bought drugs, test. It was around like 4 something, or maybe not up to 7, maybe not up to 400, for everything. But me, I budgeted more because being a single mother, my children will feed, even though their dad, of course, will do his part for them, did his part for them. In fact, he really tried for them that period. So, but, I budgeted more money because we were going to feed for some time. I will not be able to work. So, depending on your situation, I feel like you should just budget like 500,000 at least. In fact, now, I said this is 252. Right now, the price might have gone up. They might have increased, because it was last year June. It's 1 year now. It might have increased maybe by some percentage. So, I would say you should just budget, like, for those that want to do in this hospital, because I'm willing to tell people, just that I don't want to bring it up here in the open. Let the hospital not come and drag me. It's a government hospital. They may not be happy that I mentioned them and because plenty people may now go there. So, but for those that will call me, I'll be willing to tell them. So, you can budget like 500, but I know, but feeding and all of that, depending on your situation, because you will not be able to do anything much for 6 weeks. So, let me just round up with these things. We're not going to go off. Meanwhile, please subscribe to my channel. I'm on 500 and something for years now. If this video can get me to 1,000, I'll be so grateful. I'll be so grateful. So please subscribe to my channel if God puts it in your mind. But if not, no problem. So, what was I going to say? So, when I got home, now the only painful period, because the drugs they gave me, once I take them, I don't feel pain. The only time I feel pain is if I sneeze. And then I'll have to hold my belly. It's always very painful. I won't lie about that. So, and then getting up and lying down, getting up from the bed and all of that, that's another painful experience. But aside that, the surgery is so sweet, so sweet. Let me see. I don't know if there's anything I'm leaving out. If there's nothing, then there's no point making another video. But I'll be more than willing to answer questions. So if you have any question, just drop it. Maybe I can now do more videos to answer your question. I think that will be better. But for now, please do this surgery. It's very easy. And then do it. Don't be ashamed. Don't be ashamed. It's a normal thing amongst we black women, black African women. It's a normal thing. It's even common. You know, a lot of people have it. Trust me, it's when you speak up about your own that you will now know that people are also hiding it. But there's nothing to hide. In fact, what made me make up my mind that I was going to do this video is because I couldn't find a lot of Nigerians. Like, I wanted to, like, when I, researched about this and all of that, I was seeing more of videos from people outside, people that are not Nigerians. I wanted Nigerian video that I can relate, that you can be able to relate, especially based on what you eat, because those videos they were eating their, what people eat now. But I wanted a Nigerian video, because you must not eat anything that will make you poo, that will make your pooing difficult. Do you understand? You must not eat anything that will make it difficult for you to poo in those first few weeks, so that your stitch doesn't open up. I'm still going to probably show us video of what my own stitch line looks like right now, which I feel like it is part of why I'm making this video, because I don't know if it is normal. I feel like I carried every object quite early, because it's just me and my children. So we had a lot. Around that time, we had issue with our pumping machine and all of that. I had to fetch water, buy water. So I know, and then walk through. So I don't know if it's because I carried every object quite early, but trust me, it is quite hidden. It is hidden. It is hidden. Let me see if I can show us. It is hidden. And then another thing, I thought that my tummy would be flat after I removed the fibroid, because of course I've always had a normal, relatively cool flat tummy, because I was very slim before I started having children, and I had my first baby at 24. So at 26 I was done having children. So my body went back to normal quickly. So I just thought that after removing the fibroid that my tummy would be flat Trust me, my tummy was swollen. That is the part they didn't really tell us at the hospital. So I feel like there are some questions you ask and know what to expect. Don't think that your tummy will not be flat though. I feel like maybe people that did CS now, they will know about this. And now I could even now understand why some people that did CS usually complain of big tummy. So my tummy was swollen. I think it's because of the pool, trying to after the incision. So my tummy has not gone back to normal. Even the woman that did that one too, she called me and complained. My tummy had not, but I know probably it would still go back to normal. But my tummy, that I thought to be flatter, you see now, like this part now. In fact, another thing, everywhere around there for the first few weeks, months, I wasn't feeling anything. It was just numb. It was just numb. See, my tummy wasn't this big before. So I feel like this part wasn't part of my body before. But look at, I can say. So now, why I'm complaining now? If I wear pants, you won't even know that I did anything. But I feel like maybe it's not supposed to be like this. I don't know. If anybody that has done their surgery can tell me if their own is like this. I was expecting it to be flat. So I feel like maybe I carried every object. That's why I have this. I was hoping it to be flat like this side. So, but that is what it looks like now. But it's not. It's no problem as long as I have life. I'm okay. I'm happy. In fact, I'm the happiest now, because that thing was a big problem. Although I've not gone to do scan, no. I've not gone to do scan, no, because I'm scared. They said it goes back, but from what they said and from the research I made, if you have multiples, there's tendency that it will go back. Like if you have a lot, there's tendency that it will go back. Although now I would have opted for. At the point I was thinking I should just remove my womb. They should just remove my uterus. But the reason why I didn't remove it is because, like I mentioned earlier, I'm currently going through my divorce, and of course, I may remarry. I don't know what the future holds for me. So I didn't want to make that decision by myself and just remove my womb. I wanted to like give my partner, my future partner, an opportunity to have a say, to be able to decide on what I do to my body, and not just go ahead and remove the womb. You know, who knows? I'm done having children, but my partner, the future may want to have more kids. Anything, even though me, I do not wish to have more kids, you know, but I just don't want to make that decision. So maybe I would have gone for total uterus removal, which is hysterectomy, what do they call that one? So, but from what they said, you know, those that are done having kids, it's fine. You know, you remove your uterus. But for those that have not had kids too, you can just go ahead and do the surgery. Trust me, they will be careful. Just explain to them you've not had children, you still want to have children. They know what to do. Maybe you see this lady. This actress. Maybe we all know when she did her surgery. And we were all aware when she said the thing grew back. But look at her now, she's pregnant. And I'm sure the pregnancy will shrink it. You know. But for those of you that, you know, I wanted to say, if it's not disturbing you, don't bother to remove it. You know, yes. And that's what I feel. But if it's quite big and it's probably resting on your organs, which is why you need to be doing tests from time to time. Me, I don't encourage anyone to remove it if it's not disturbing them. But just make sure that you check the location to know that it's not disturbing anything in your system. If it is not disturbing any resting on your organ, trust me, and you don't have symptoms, by all means leave the fibroid. Except if you are not okay with how big your tummy is getting, you know. But aside that, just leave it. If it's not disturbing you, if you are not bothered about the size of your tummy, if it's not resting on your organ, leave it. But if you are having this blood flow and you are not even close to menopause yet, just like in my own case, I did it at 37. So I don't know how my mom stopped her period at 50 something. So there's no way I would continue life like that. You understand? Always like I couldn't. Anytime I'm on my period, I'm not able to step out of my house, you know, until I'm done. So it was affecting the quality of life that I was living, and I wanted to enjoy life. So right now I'm the happiest, you know. So please, if the fibroid is disturbing you, go ahead and remove it. If it's not disturbing you, fine, leave it, and just make sure you do scan from time to time. Check, you know, full body so that you are sure that it is not affecting any other parts of your body, even if it is not symptomatic. So whatever you want to ask me again, feel free to ask me, because I don't know what else to say. I don't know what I'm leaving out. So, but recovery, you know, it's usually 6 weeks, but trust me, 2 weeks, exactly 2 weeks after my surgery, on a Monday, I went for a friend's grandmother's burial, and I was dancing and jumping. In fact, maybe this jump is why I have this thing, by the way. Maybe that jumping is why I have, because I said that I was happy to go out to party that day. I was jumping. In fact, people that knew that I did surgery were telling me, calm down. I was jumping and, you know, having fun exactly 2 weeks after my surgery. So trust me, you know, it's not so bad. You know, the pain is just for a few, and it's just when you sneeze. Like it's the experience is not bad. So please, I don't know what to say again. Again, subscribe to my channel, please, if you don't mind. If I can get to 1K subscribers, I'll be very happy. But if not, I'm also okay. I'm happy to like share my experience, and I wish everybody well. If you choose to do it, if someone told me, I should share my experience, I don't know, I may be saving life and all of that. Trust me, I want you all to be fine too. If you choose to do it, please, I wish you well. You come out fine in Jesus' name. Just please choose a good hospital. If you're in Nigeria, if you're on the mainland, and you want to talk to me about the hospital, feel free to call me. I'm going to share my experience and share the hospital with you. If you're on the island, there's island maternity or whatever, all those, just go there. Make sure you are sure. And then if you have good money that you know you can afford a private hospital, so please, by all means, go to that Dr. Falade. In fact, just go and follow his page first. I've not seen his page in a while now. Maybe because I don't really engage. And then there were times that all those huge fibroid kind of scared me, you know. But they are very good. So you can also go to them. In fact, they said they have I've forgotten foundation something that probably discounted, and that always discounts the surgery fee. I really don't know, but me, I just didn't have anything Everything. And then going to the island too was another thing for me, I now thought, okay, how will I be coming back, the stress. But I know people travel from abroad to come and do that test in Nigeria, to come and do that surgery in Nigeria, especially with that Dr. Fala. They just follow him, you will see. So, but that's it for now. I'm happy that I've gotten this out of my mind. It was as if I was owing one say, like owing billions of naira, because I know I had already promised to talk about it, and we've gotten the 100 likes since that night or so. So I've fulfilled my promise now. I'm debt free. I'm not owing you again. I wish you all the best. If you watch this video up to now, yeah, kisses to you, and please subscribe to my channel. Thank you. I wish you well. I wish you safety. Anyone around you, please encourage them to do the surgery. If they are symptomatic, they will be fine. They will be just fine. Trust me, they will be just fine. All the best, guys. Thank you so much. Bye. I'll probably do more videos. If you have more questions, or I'll answer your questions in the DM, in the comments. But I think I've touched everything so far. Yeah, I think I've touched everything so far. I know there are some things that probably I've not touched, So, but probably about the plaster, that's I'm still going to probably put some videos at the end of this. The hospital that I used, they put all those brown plaster. That one can be so painful. So, but if you want, you can just buy that other white side. That one is kind of softer, because I feel like the plaster too kind of injured my, injured me. So if you have a very soft skin, if you have sensitive skin, you may want to go for that white, plaster. I just hope I didn't leave out anything important in all of this. I know I'm just talking about it like a gist, because I'm not a doctor. A doctor will tell you and probably use some medical terms. For me, I'm just teaching you about my own experience. So feel free to read more about it online, to research, watch people's videos on YouTube. Trust me, those were the things that helped me. I would watch people's YouTube videos, and then I will now go to comment section. You see people that were saying, oh, they did it too, they did it so yeah, they did it, they did. Don't be discouraged. Some people may say, they did it and they grew back. Don't be discouraged. Don't be discouraged, please. So just watch videos and be encouraged. Watch those YouTube videos, Google research, about what and what to eat. Of course, trust me, they said if you stop eating some certain things, it will shrink. But me, how many food do we have? Me, since, in fact, I've been drinking my Pepsi back and Coke. God will help me. I've been drinking it back. That's why I said I'm scared to go and do the scan, because I don't know. But maybe one of these days, I'll go and do it. Now that it's 1 year later, maybe I'll just close my eyes to go and do it. But I'm really scared of what could. But I pray it is, because they said if you didn't have much, I only had the one big one and one small one. They said if you didn't have much, and then for my own to go to that level, it took a space of 5 years, from when I fixed the implant, family planning, till 2025 that I removed it. So 5 years for it to. So some people, they usually have multiples, like plenty, so in a space of like 1 year. So they said that if you have multiples, there is a tendency that it will go back, But of course, if you go for the surgery like that, if you are disciplined, if you're not like me, once you go for the surgery, just watch what you eat, and it will not go back. Mommy, I've been drinking Pepsi again. But it is one. Again, thank you. This girl can talk. Trust me. I can talk. I enjoy talking a lot. But I didn't know that I would still be talking to my camera and be enjoying it like this, and I don't want to stop. So, but I need to stop now so that I can post this video and my mind will be at rest and know that I've submitted, And then shout out to my Instagram followers. They are the reason why I did this video. Shout out to them. I promise, I posted about it on Instagram. I promised to make a video. So shout out to you, all my customers. Thank you so much for your patronage. You all are the reason why this girl is still it's feeding. Because if you don't buy from me, what's in our one shop? So shout out to my customers. And And then for you watching this video, I am into ready to wear. I produce outfits. If you don't mind, check me out on Instagram, capture picture, buy from me. My outfits are really affordable. You know, I sell ready-made outfits. All my outfits, you can pick them up within 24 hours. In fact, you can walk into my store to pick up. But for delivery, we deliver immediately. Within 24 hours of your order, we deliver. We don't give 7 working days, 4 working days, all those things. We are not a made to order brand. We are ready to wear. All our outfits are ready for you to wear. So feel free to patronize me. Again, I don't know what else to say. If there's anything I remember, it will pain me that I have not touched everywhere. But I'm not going to share videos of. I know I'm missing some things because there's no way I'll remember everything. So I'm going to share some videos of a few days after. How it is looking. How when they open it at the hospital, how it was looking. I'm going to share because I don't know how to blur those things. I don't know how to edit. I'm not going to edit this, so I'm going to post it directly. I don't have time, please. People share me to manage it like that. Anyway, if you even watch it to this level, that means you've managed it like that. So thank you. Bye. My son is trying to open that door. This boy, go and read your book for your test. Go and read your book. I know you are trying to open the door. I don't know what you want to come and do outside. Bye bye. Thank you all so much. I love you all. Thank you. God bless you. Bye.